Dr. Tim Kosinski back again, and I want to take a few minutes of your time to tell you about what dental implants are all about. What a dental implant is, quite simply, is a piece of metal made of titanium. Titanium is a biocompatible material. Big $5 word that means the bone actually grows into the surface of the metal and it becomes a permanent part of your jaw. It allows us to anchor something to it. One tooth, several teeth, all your teeth, a denture, partial. But we will evaluate your particular situation individually. There are two criteria for people who want implants. Number one, you have to be relatively healthy, meaning no uncontrolled healing problems, uncontrolled diabetes, uncontrolled hypertension, immunosuppressive diseases like AIDS and things like that. The second criteria is we have to have enough bone to be able to place something into it. And we have some very advanced technology. We have a dental CAT scan or CBCT, which allows us to analyze your jawbone in 3 dimensions. It's a very helpful tool. The implant surgery itself is fairly simple or routine. Certainly not routine for you, but fairly routine for us. Bone is alive in the body. It constantly changes over. If you've ever broken a bone or broken an arm, you know that you're in a cast for 6 weeks. And that same thing happens with our dental implants. It has to be allowed to heal before we can actually give you a tooth. The surgery consists of numbing the area. Okay, we normally don't have to numb your whole jaw, just the area, because bone itself is not innervated. Bone doesn't have any pain receptors in it, but we have to go through the gum tissue. So we numb you just locally. We have a series of drills, 1, 2, 3, and an implant is like a spark plug that's actually threaded into the jawbone. It will be buried underneath the gum for a period of time. On average, usually 3 months in the lower jaw, 4 months on the upper jaw. But the time is really dictated by the quality and quantity of bone that you have to work with. After the implant has a chance to heal, all implants are internally designed. There's a pattern on the inside. So we will make an impression. We'll actually put a little post or rod into the implant, and we'll use our computer to make an impression, or we'll put the impression material or goop in your mouth. That information is sent to our laboratory in California. And everything we design today is CAD/CAM design. It's all done by computer, just remarkable technology. The laboratory will fabricate the second part of an implant is called an abutment. That's a funny word, abutment. It's like Abraham Lincoln's top hat. It'll engage into the implant and it's locked into place. The crown will either be cemented or threaded into position, depending on the circumstances. Now, our implants today are extremely successful, but every once in a while an implant doesn't heal the way we want it to. So let's just talk about that in the very beginning. Why would an implant not heal? Well, inability or unwillingness of you to keep it clean or maintain it. So we have to design it so that you can maintain it not only today, but in the future. Engineering is very important to me, and we only use the best, highest quality implants available. Be very conscious of that. You see a lot of marketing and of dental implants out there, and I want to assure you that I use the best of the best, what I would use on my family. Smoking can hinder healing, and I think that's very intuitive. We're going to put a little hole in your jaw, and smoking, tar, nicotine, heat could affect the health of the implant. And a very tiny percentage of implants don't work, and I don't know why. Could be the implant, changes in body chemistry, hormonal changes, my surgery, could be 1,000 things. But I want to assure you that for 36 years I've warranted what I do, meaning if something negative should happen that you can't predict, that I can't predict, it's my job to make it whole again. And we have a written policy to that effect. We want you to have a wonderful experience here in our practice and improve the quality of your life to a high level. We want you to chew efficiently and really enjoy your smile, even behind that mask that you're wearing today. So we hope to see you soon.